In spite of the Interior Minister's dismissal of calls for a total lockdown, the director at the Noguchi Center for Medical Research says Ghanaians should be worried following the death of a second person because of the coronavirus. According to him, the development presents a clear challenge for the country in stopping further spread of the virus, which is wreaking havoc globally. In an exclusive interview with my colleague Elton John Broby, Professor Abraham Kwabena Annan proposed testing and lockdown of communities, adding the days to follow present clear danger for the country.
You should be worried, but remember one thing: health is not just a physical well-being, it is physical and psychological well-being. So much as we should be worried in the sense that we should identify that there is a challenge, and then we should then channel our energies and resources into using the methods, the approaches, the tools we have to be able to mitigate the challenge, to stop the spread of COVID. So really, we should not be afraid. As for fear, is an enemy. If anybody is afraid, it weakens all of us, especially if you were to get infected, diagnosed to be positive with COVID-19. The last thing you should do is to be afraid. You shouldn't be afraid because it can be managed, even though there is no treatment.
Next week is actually crucial for Ghana.
Yes.
Why is it so?
Yeah, this week and next week are extremely crucial because we need to take a very important decision. The decision is concerning whether to lock down or not to lock down. But you see, to lock down or not to lock down, it depends on so many factors. Some people are a bit hasty, thinking that we should lock down, But it's not that simple. You have to consider so many things. Don't you realize that countries like even the United States of America have even issued mitigation measures like we give every American $1,000, that kind of thing. Why is that being done? The point is that if we will lock down, there are so many social safety nets mechanisms we should consider. We should remember, for example, even water in Ghanaian communities. There are many households without running tap water. And if you lock down, if they don't have water, where will they go? They have to go fetch water or go get water from somewhere, or you will send water to them. If you use tanker services to send water, then you should be very careful you don't call that the tanker is here, come and collect water. There will be no social distance, nobody going by social distancing, that kind of thing. So it is important for the system, the government, policymakers to look at and do an analysis. That is why this week and next week, we need to be able to begin to take steps like doing some screening, some mass testing. That will give us a better understanding of what is the picture emerging. And fortunately, some of the rapid tests that are coming up, which we are in the process of evaluating now, can help to take a lot of very important, even game-changer decisions. For example, even simple tests like antibody detection tests, detecting IgM, IgG. These kind of tests, if you run it in a population, and the population is not exposed to COVID-19, you will get no positives. If you run it in a population and you begin to see that positive here, there, scattered, you can see a pattern. And therefore, based on that, we can even do an information, based lockdown, not necessarily everything boom at once. It can be done in a strategic manner, and then you can contain. Some communities may have to be cordoned off so that they are protected. Some will have to be cordoned out so that they are managed because there are positives there, things like that. So that's, I think, the scenario.
I think I'm before here, but let me ask a final question. You've done so many tests, including HIV and others. Would you say that COVID-19 is different from all you've done? Is it sophisticated, or it's just like any other test you've done?
The test itself is not so different or sophisticated, but the test result is complicated. The reason why I'm saying that is that this is a case where you have an infection that you may get somebody coming from even outside, which is a very high risk factor there. And then you test the person immediately he arrives and he will be negative. You may be tempted to say, okay, he can go home. You are free. But it doesn't mean the person is free at all, because the person could have an infection which has not developed to a stage where you find it to be positive. You know, that kind of thing. So when we get a result, we have to be even careful with the results. When you find a person like that negative, then the government is doing the right thing by saying that you still quarantine you for 14 days.
But is the virus becoming opportunistic, so the fact that we are hearing that those who died had other ailments, and yet they were tested positive for COVID-19? Will you say that the virus is becoming opportunistic to disease?
Not necessarily. The virus is causing more damage in people who are compromised. And here in this case, compromise does not mean just immunocompromise. Compromise means conditions like being diabetic or having hypertension or having some maybe infection already, some pneumonia-like kind of, potential already. So such a person, and that is why the older people appear to be more at risk.